Hi guys, thanks so much for joining us. I'm Dr. Shaw, this is Nayeli, and we have our wonderful patient Bobby with us today.
Hi Facebook people!
It's an awesome Friday. Thanks so much for coming back and joining us at Butology at our beautiful Southwest location. The weather's beautiful. We're going to make it a little cold in here today though, I think. We're going to get a little chilly despite the beautiful weather outside, but for all for a good cause. We're going to do an amazing new treatment today that we're offering to Kern County residents and even beyond. It's actually our cryo-freeze therapy, our cryo-freeze. And today we're going to be working on the face on Bobby. The cryo-freeze therapy is cutting-edge technology. It's been around all around the world for several years. It's kind of gotten its roots in Europe and made its way to the United States a few years back. And it came in the form of whole-body cryotherapy, but we found that it's doing so well for all parts of the body, including our skin. We said, well, why not work on mainly the skin of the face? And it's an area that, of course, bothers all of us. And at Butology, of course, we know that the face is such an important thing that we need to kind of turn back the clock for. We're offering this brand new therapy to help do that. And so today, Bobby, our patient, has volunteered. Thank you so much, Bobby. She's an awesome, she's a total sport to get her face frozen today. So to speak, we're going to be using our Zimmer cryo machine. It's a wonderful non-nitrogen based cryotherapy unit which chills the face down to about 50 degrees Fahrenheit or about 10 degrees centigrade. And Nayeli's going to be doing that today, that treatment on Bobby today. And what we're going to accomplish by doing this is we're going to stimulate collagen. We're going to get the blood flow going, and we're going to bring out some healthy, new, tighter, firmer skin to the surface. We're going to hope to get Bobby some nice pore closure, a tightening effect, and we're going to see also one of the great things we see with just cryotherapy in general is a nice endorphin release. You know, our natural endorphins release. So what we find is with this therapy, our patients are invigorated. They're feeling energized. They're ready to get their day started. The great thing about this treatment is there's no downtime. It's kind of that gym workout. You're in and you're back out to your regular routine. And in fact, speaking of the gym, we do have a lot of our clients that come over from the gym, and they'll come over and get one of these cryofacials or these cryo freeze therapies or cryotherapies for their body or face to just kind of keep them going. So yes, we're about to get started. I know, Vanessa, we have a few cool things we want to offer to our Facebook Live viewers before we get started here. Is that right?
Definitely. Before we do that, we have some questions.
Oh,
and I think
sure, let's
and I believe Dr. Shaw has already answered what is cryofacial by Sammy. And Sammy also asked a follow-up question, does it hurt?
So the cryo-freeze therapy, we are getting the skin nice and cool, and we're monitoring that skin temperature. You know, we want to get it at a therapeutic temperature, which is again about that 10 degrees centigrade, 50 degrees Fahrenheit level. Now, does it hurt? It does get a little cold, and that cold, for some people, if it gets a little bit too uncomfortable, we're adjusting the therapy, we're adjusting the temperature, we're moving that wand around. This is not meant to be a painful procedure. It's meant to be a little relaxing and invigorating, if anything. And you know, Bobby's going to give her, and I told Bobby to be honest. I want her to be honest with our Facebook crowd. She's going to give us her best testament as far as the pain goes.
Yes.
A little bit. But it's not really meant to be a painful treatment. It's meant to be more revitalizing, more invigorating, if anything.
Fantastic. So yes, before we get started, everyone, I see a lot of hearts. We love it. Thank you, everyone. Thumbs up.
Awesome.
So
Thanks,
all of that, you will be rewarded. Okay, so please tune in. I know we're gaining some followers as we have begun. So if you share, like, comment on this video today, you will win 1 full week of cryotherapy. That's 1 full week. Yes!
Oh, that's awesome. Yep. So. And you know, we do have the cryotherapy units at both of our facilities. We have it at both at Bakersfield Southwest, Butology Southwest, and our Bakersfield Central office over at Commerce. And so we do. It's a wonderful machine, and yes, that 1 week is great. Come at either facility, and yeah, we look forward to seeing you.
Yes, and before we begin as well, we have more questions coming in.
Okay.
By Robin, is the coldest tolerable the best outcome?
No, not necessarily. It's really, again, getting to that therapeutic temperature. We have to be, mindful that the skin can only take so much as well. There is blood vessels. We're trying to stimulate those blood vessels. We're trying to stimulate blood flow, oxygen flow, healthy new nutrients to the skin. But there is such a thing as too much is a good, is a bad thing. And so we don't want to get too cold because then we could run into, risks as well. And so again, we're actively monitoring the skin temperature. We're not getting too cold. We're just getting to a nice, comfortable, therapeutic temperature. Good question, though. Yes,
very good question, Robin. We have a question by Pavan. Can we use this only on the face?
No.
He has seen that. He has, as a follow-up here, he's seen that they have used this therapy on the back and neck and also other areas.
That's a great question. No, actually, as you know, the reason this is more of a unit that's meant to go after very specific areas. These units came about from the full body cryotherapy chambers, and that's where it all started. Full body cryotherapy, as you know, our clients will go into these chambers and get a treatment from head to toe, where we're not just going after the skin, but joints and just circulation and all of it all together. Well, with these units, we can definitely focus on certain areas, and the face is a very popular area, especially at Beautology. We do a lot of facial procedures, and this kind of goes hand in hand. But no, the cryotherapy treatment can be done on the face. We can do it on the décolleté or chest and neck area. We can even do it on the shoulders and even beyond. So any area where there might be any kind of joint ailment, for example, is a great area to use the cryotherapy treatment. But again, the face is a very, very popular treatment.
Wonderful. And Diana would like to know, how long are results expected to last?
Well, with the cryotherapy treatment, it is an ongoing type of treatment. It's something where patients will initially come in maybe a couple times a week just to kind of get jump started, really start feeling that pore closure, that skin tightening, that collagen remodeling. And then what we recommend is a maintenance routine, maybe coming in once every week or maybe twice a month to maintain those results. And again, it is a very quick in and out treatment. I mean, today's treatment shouldn't take longer than about 10 minutes. And so it's quick in and out. It's something where either you're done with your gym routine and you want to get a little chill before you go back to your regular routine. We just kind of add that into your daily routine, or again, nothing with any downtime at all.
Fantastic. So, Bobby, we have some shout-outs for you. Robin says hello, and Sammy says you are beautiful.
Oh, thank you so much.
Bobby's very beautiful. I mean, there's not too much more we can do for her, but we're going to try today. We're going to see if there's anything.
Yes, and Sammy would also like to know, how long does this process take?
Today's treatment is going to be, we're going to start in just a couple seconds here, but just 10 minutes really. 10 minutes as that number is found to be kind of like that key number to get patients a good result, that endorphin release, that stimulation, that pore closure, that tightening effect. And so just a quick 10-minute treatment.
Fantastic.
We're going to get you started here in just a second. Generally, we do ask a couple medical questions. We want to find out, do you have any medical conditions that make you more sensitive to cold in general?
No,
Okay.
not at all.
And you're pretty healthy overall.
Yeah, I am.
Absolutely.
Yeah.
Very good. And of course, I'm looking at her face, and you can't get this therapy if you have any open wounds or cuts or sores or any kind of signs of infection. It's not a good time to get a treatment like this, of course. But Bobby's in great shape, and I think she's a great candidate. I wanted to ask Bobby, do you have any questions about the treatment before we get started here?
Now that you said that, I do have a question.
Mm-hmm.
Like, people with acne shouldn't get this?
Well, yeah, acne isn't generally like an open sore or a wound. So if you have like an acne breakout, and if it's not really bad cystic acne, it's okay actually. Because again, with this, we're actually increasing blood flow. We're stimulating collagen, and actually one of the things we see is as the skin kind of turns over, our hope is to maybe kind of tone some of that acne down and improve acne scarring. Really.
Right.
So if you have acne, this is a good treatment. Now, if you have really bad cystic acne, and there's maybe some infected acne, we should probably get that acne under control before we start working on the scarring. But that's a good question.
And this is for men and women too?
Absolutely. Gosh, yeah, guys just as much as gals. And in fact, unlike a lot of things we do, and it's changing, cryotherapy is kind of more of a male-dominated type of treatment. The actual cryotherapy chambers, the cryotherapy units has been up till more recently more male-dominated. Now we're seeing couples come in, husbands and wives, doing it. But the cryofacials, no, girls and gals, and I think guys like it because it is that kind of quick in and out, like I said, we're close to our gyms over here, and sometimes, getting that good workout in and then maybe getting that endorphin release right after that gym workout is, just kind of goes hand in hand. So no, girls and guys equally.
One more question. Is it very pricey or just not very?
Yeah, I think it's not very pricey at all.
It's $60 per session.
So $60 per session. So generally $60, and then is there like a monthly package or something?
Monthly package for $199 if you're interested in 4 treatments per month.
Okay, so it kind of drops it down a little bit.
Yeah, that's really good.
So not too bad at all.
All right.
Wonderful. So Sammy says that's awesome, quick and easy. And Robin has another question. Is there downtime? Does she need to take time off of work? That's a really good question.
Great question. Thanks for throwing these out because I do forget to answer all this. No, there's no downtime at all. In fact, I would actually get the cryotherapy treatment done right before work. So I am totally fully energized, ready to go for work. And so you can do it right, right after you have your morning cup of coffee, or even before your morning cup of coffee. We'll serve you the cup of coffee, get your facial, get your coffee, and then go to work.
Awesome. Now, Bobby, you and Sammy were on the same wavelength. She had questions about acne, which Dr. Shaw had addressed. Now, Linda has also is asking, is it painful during or after the treatment, and does it diminish fine lines?
Sure. So, again, a lot of this stuff has been pioneered in Europe, and there are actually medical studies out there that have been done on larger scales. And we're seeing that cryotherapy does not only cause pore closure, but it does improve fine lines and wrinkles and causes a tightening effect. To answer that pain question, again, no, this is not meant to be a painful procedure at all. And again, I'm going to have Bobby kind of attest to that. I don't want to put words in her mouth. I want her to tell us if this is going to be a painful treatment.
I'll let you know.
Yes.
Bobby's going to let us know in just a second. But great questions, though. Great questions. Keep them coming.
Wonderful. Bobby, this one's for you from Aaron. Hey, babe, you look good.
Hey, that's my husband. Thank you.
That's awesome. Thank you. Thanks for watching, Aaron. So let's get started. Let's get Bobby going here. So this is our wonderful machine. It's our cryotherapy machine. It's made by a large company called Zimmer. They've been in the cold business for many, many years, and this is kind of their workhorse. So, all right. So Bobby, what you're going to feel is just a nice cold blast of air. And I'm going to actually have Nayeli kind of walk you through this here.
Okay.
All right.
So what I'm going to do is I'm going to have you put on this eye here. So I'm going to place this over your eyes.
So we're going to put these goggles over your eyes, and then we'll have you kind of lean forward for just a second. All right. And we're going to kind of tighten them in the back.
Okay.
All right. Is that comfortable?
Yep.
All right.
Perfect. So I'm going to start with the forehead, and then I'm going to work my way around your whole face and a little bit around your neck and your chest area.
Okay.
And if for any reason you feel any cold scenario too much, just let me know. All right. So we'll get started.
So we're blowing really nice cold air. Now, the machine is actually blowing it out much colder. The skin, of course, with our natural blood flow is warming some of that cold air. And so again, our aim here is to get to 10 degrees centigrade or 50 degrees Fahrenheit. I'm going to grab Nayeli's pointer just to kind of give you guys an idea of where we're at. This is a laser pointer that actually tells us what temperature we're at. So we're only at about 20 degrees centigrade, and we're just kind of working our way down right now, okay?
It actually feels like an ice cube just melting on my face. That's what it reminds me of.
An ice cube melting on her face. That's a
Yeah.
great analogy.
Yeah.
Okay, so far not too bad?
No, not at all.
Okay.
Not at all.
All right.
Ladies, after you get your lips done, I've had Restylane done. After you get your lips done and they give you that little square ice pack, that's pretty much how it feels.
Now we're getting a little colder. We're about 15 degrees centigrade right now. I'm going to actually give this to Nayeli because I feel like I'm stealing it from her.
How are you doing?
I'm doing good.
So we're getting questions as this is being performed here by Nayeli. Deanna would like to know, can other areas also be done?
Yes, again, this is not subjected to just the face. We at our office can do the neck, the chest, the décolleté area basically. We can do the shoulders. We can do other parts of the body. Again, this treatment came out many years ago. For sports medicine or rehabilitation to help out with joint pains, rheumatoid arthritis, fibromyalgia, all kinds of things. But then it was also found not only is it healing the body within, it's healing the skeletal organ system, the musculoskeletal organ system. And we also found as an organ, it's also helping with the skin as well. The skin is the largest organ in our body, and it's regenerating that skin, reproducing that collagen. And so just about any area, in the beauty industry, at Beautology, of course, one of our biggest things is the skin. And so we are working on skin, just about any skin that has lost elasticity, that has that crepiness that's happening, or, again, that has pores or scars.
Wonderful. Karina would like to know how many sessions are needed.
Now, Karina, this is kind of one of those ongoing type treatments. It's like going to the gym. You want to, constantly work out those muscles. If you do stop at any time, of course, that muscle mass will gradually deteriorate. What we recommend is coming in a little bit more often at first, maybe twice a week initially, 2 to 3 times a week initially, for about a month or so, and then maybe maintaining that with a treatment once every 2 weeks. That would be a good maintenance routine.
Great. And Linda would like to know, are we the only spa with this treatment?
As far as I know, in Kern County, we have 2 locations that offer the cryotherapy for face treatments and basically body treatments as well. Here at our Southwest office, our Southwest facility at Grand Islands, and of course our larger facility over there on Commerce at Truxton Extension.
Great. And Bobby, another shout out by Heather. She said those lips look amazing.
Thank you, Dr. Milan Shaw did them.
So we're about 13 to 14 degrees. Oh, we're about 11 degrees right now, and so we're close to very therapeutic temperature on this cheek. Bobby, how's it feeling right now?
It actually feels really good. I'm not having any problems with pain or anything like that. It really feels good after you just lay here and relax and just let it hit you, and it feels great. I like it. You sure you can only do them for 10 minutes?
Yeah, no, 10 minutes is, again, based on studies, it's found to be kind of like that therapeutic time frame as long as we've reached that temperature. But, when we do it with whole body cryotherapy, it's actually a little bit shorter because you are going after the whole body. But yeah, no, you're going to love it. And, it's not just the actual treatment, but, the after effect. Usually, when I have had cryotherapy, right after the treatment, again, I feel totally invigorated. My skin feels a little tighter, a little bit firmer, and I just feel a little bit more energized. So it's that benefit you get after the treatment that you really love.
Yes, and Rosa is asking again for the price. That was $60 a session, and we do offer package pricing as well. So Rosa, definitely give us a call.
About 10 for 10 degrees.
I can actually feel my skin tightening up.
So Bobby just said she could feel her skin tightening up, but we do hear that quite a bit. And actually, we've also seen there are facilities that will do 2 or 3 of these in a week, and they'll get that almost non-surgical lifted or firmed up look. And so you have that event during the weekend. You don't have the downtime. Definitely you don't have the downtime of, say, one of our surgical procedures. And you don't have the downtime of one of our laser procedures. Doing 2 or 3 of these in a week before a big event, a wedding, a party, is a great idea because you do get that tightening, that firming effect quickly with no downtime.
Right. Now Linda is asking, is this similar to a dermabrasion treatment?
So great question. There's 2 types of dermabrasion. There's of course deep dermabrasion that our plastic surgeons do in the operating room. And that of course is a lot more intense, aggressive. They're removing layers of skin. There's microdermabrasion that our amazing estheticians do next door, and this is a little bit different. With dermabrasion, we're actually exfoliating skin. We're removing that top layer of dead skin. What we're doing with a cryotherapy treatment for the face especially, we're really working on stimulating collagen, stimulating blood flow, stimulating nutrients. So we're working more from the inside out rather than the outside in. But as far as downtime goes, again, this one doesn't have any downtime at all. You'll see Bobby in a few minutes here. She'll be done. She may look a little flushed, if anything, but she's totally okay to, attack the rest of her day.
Great. Dr. Shaw, Sammy is asking, are there side effects?
Side effects. So, of course there can be side effects with any procedure. With this, we're doing two things. One, the machine itself is kind of regulated as to how much cold air it can deliver. Two, we're actively monitoring the temperature. Now, with those two precautions, together with the fact that we know Bobby is a good candidate for this medically, we're potentially avoiding all potential side effects that can happen. For patients that have certain hypersensitivities or sensitive to cold therapy in general, there are certain diseases out there, Raynaud's phenomena being one of them. Basically, where your joints can get lose blood supply. They actually turn blue from cold air. Or say, patients that have had frostbite prior, or anything that's kind of related to some sort of sensitivity with cold. We have to find some other therapy, maybe a general, a regular facial therapy. But again, if we're making sure the patient's a good candidate, we're monitoring the temperature, the chance of getting any kind of negative side effect is virtually null. Now, what can we do? Well, if Nayeli's saying, and she's not going to do this, but if she held that cold blast of air on one part of the skin for too long, obviously we can cause a burn. It's not going to be a hot burn, it'll be a cold burn. And it'll be a cold burn of the skin. And we're not doing that, of course. But, that could be a potential side effect in the untrained hand.
And Sammy is also asking, is it refreshing with the Fresno heat?
With the Fresno heat, absolutely, yes. We do find we're a nice, comfortable 10 degrees centigrade right now. We're doing great. I'm sorry, I'm going to answer that question in just a second. Bobby, how are you feeling then? Now that we're pretty close to 10 degrees everywhere, what would you say?
It's great. It's great. I don't feel too cold. It doesn't hurt. My skin feels like it's tightening. I mean, it's great. I love this. Honey, I need $60 for the next few months of my life.
The Fresno heat, yeah, with the Bakersfield and Fresno heat, or just about anywhere in Southern California, on those hot summer days, and we're getting out of those, of course. But yeah, it's always a great idea to come in and get your cryo treatment done then, because not only are you cooling down, but you're getting that invigoration.
So we're at 10.
Can you do this every day, Dr. Shaw?
Well, we like to give you a day in between. So, three times a week. You could do it every other day. Okay. That would be great. It won't hurt you to do it every day. But again, based on standard of therapy, standard of treatments out there in the world, we find that initially that 3 times a week is very effective. But no, it doesn't hurt. If you want to double up on a couple days, it's not going to hurt you.
Okay,
Mm-hmm.
all right. I feel wonderful. That feels really good. That's tight. I feel tight.
Great.
I feel like I'm 20. Do I look 20?
Yes, Bobby. This question's actually for you. From Heather. Bobby, did you feel a rush of energy during the treatment? What were you feeling?
I feel it now. I feel like I can get up and run a mile. Of course I won't. But my skin feels absolutely great. I like it. I like it a lot.
And actually, that brings up a good point. With a lot of our laser treatments that deliver heat, we do tell our patients don't go out there and run or go to the gym right away because we've already delivered so much heat, to the skin. With this, it's okay. If you do have to do your gym routine afterwards, that's totally fine. I personally would say get your gym routine in and then come in for that nice cold therapy right after.
Yes, and Linda would like to know, why did Bobby wear those goggles?
Well, it is pretty cold air, so we're protecting our eyes. That's a great question. We're protecting our eyes. Generally you can just kind of keep your eyes closed during the treatment and you're totally fine. But, we're protecting our eyes from that really cold blast of air.
Wonderful. And Linda also is asking, what is in the package and how much is it?
The package of the cryotherapy.
Yes.
Nelly? Uh-huh.
It just includes 4 treatment sessions of the cryofacial therapy for free. So it helps, you can come once a week. So every 7 days you can come on by and we can get that treatment done for you.
Wonderful.
So once a week therapy, and that's a great maintenance type of therapy, right?
Yes.
That coming in once a week
Once
for
a
the
week,
month,
yeah.
right?
So after 7 days, we want you to come back for a next one.
Great, and that also answers our question by Sammy. What is the recommended amount of sessions? Well, a month. What would you two recommend?
So again, that initial month, that first month, come in a little bit more regularly. Let's get that collagen really nice and stimulated. Let's get that blood flow going. So maybe coming in 2 or 3 times a week for a few weeks, and then as a maintenance, once every couple weeks, or even once a week thereafter as a maintenance.
Great, and Robin is asking, is this one of the complimentary treatments you can get with the membership program Lux?
Yes, it absolutely
yes,
is,
we
right?
can, yeah. So if you actually join our membership for the Lux program here at Vitology, you actually get free freeze facial here.
How about that?
Once a week, right? Did they get the
Once a week.
Right. So with the Lux membership, lots of amazing benefits. Of course, they get the once a week cryofacial, which is again fulfilling that maintenance routine, or we're doing a vitamin B12 shot as well for energy.
Or a free endermology session.
Or the free endermology treatment. And so, endermology is a wonderful treatment for cellulite, just for lymphatic drainage. It feels like a nice deep tissue massage. It's again an in and out treatment, a little bit longer than the cryofacials, about 40 minutes or so, but a great treatment. Naili is our endermology technician here at Southwest as well, and you'll absolutely love the endermology. So yeah, you get those 3 benefits with that Lux program.
Excellent. And Linda is asking, is cryotherapy the same thing as ultratherapy?
No, totally different. So cryotherapy is basically using cold air. In the past it was done with ice baths, and then after that nitrogen was used to use cold air. A lot of athletes, would use this nitrogen cryo chamber to help with muscle aches and joint pains. And then it was used more medically for rheumatoid arthritis, and so it's kind of evolved, and then we found that it's also stimulating collagen for the skin. And so we're using cold air to basically help those organs regenerate, help the skin regenerate. Ultratherapy is a different type of device. It's using ultrasound, and those ultrasound waves are used to tighten skin. So very, very different.
Okay, and Sammy is asking, what, in your opinion, Dr. Shaw, is better, a laser treatment or this?
Oh gosh, that's a tough one. Well, we have a slew of different devices, and for example, here at Vitology, we have lasers that deeply resurface the skin. We have lasers that basically go after pigmentation. We have lasers that tighten the skin. And of course, we have our cryotherapy that stimulates collagen, that helps with pores and tightening. So, it kind of depends on your individual lifestyle. It depends on, what you can do in terms of downtime. How much time can you take off? Does the in and out 10-minute treatment sound appealing to you? For maybe a busy professional where they don't have the downtime of, say, a deep laser resurfacing, which is actually the big guy in the back over there. That's a deep CO2 laser resurfacing device. That device turns back the clock almost 10 years, but it also takes about 2 weeks out of your work week, out of your daily life. And so it kind of depends on your individual lifestyle. It depends on how much what you're looking to go after. If you're looking to go after really deep lines and wrinkles or acne scars, I think a laser treatment is going to be a lot better. If we're looking to kind of freshen up the skin, get some pore closure, get a little bit of tightening, maybe get ready for a weekend event, I think the cryotherapy treatment is an amazing treatment.
Wonderful. And Dr. Shaw, you answered her follow-up question asking what are the differences? What way to go? And Sammy has another question coming in. How long has cryofacial been a thing?
Well, I would say it's gained popularity in the United States in the last couple years. Cryotherapy for facial treatments, for just skin treatments in general, has gained popularity in the United States over the last couple years. It's been out in Europe a lot longer, Europe and of course Asia as well. The cryotherapy chambers, the full body chambers, have also gained a lot of popularity, but now they're becoming better and better. We're finding that using just a compressor that generates this really cold air rather than using actual nitrogen, the chemical on the skin, seems to be a little bit safer. So as with everything, things are evolving, the technology is evolving, the downtime is lower, the results are better, and so it is, this is kind of cutting edge stuff in terms of, the technology that we have now.
Excellent. Bobby, how do you feel?
I feel great. My skin is really, I'm starting to thaw out a little bit. That's what it feels like I'm thawing out.
Yeah.
But it feels tight. I'm amazed how tight. I mean, I feel like it's tight.
One of the things that we like to offer, and Bobby, we can get you this as well, but just like a nice hot cup of tea or coffee at the end of the treatment. It seems to like really work well with this treatment. So yeah, no, absolutely.
It didn't hurt at all. It was great.
Great honest feedback. Thank you, Bobby. Keep
problem.
those thumbs up, everybody, those hearts. Remember, if you share this the most, you win what? A full week of cryofacial therapy. So don't forget, everyone, share away. Woo!
It's worth it.
Yeah, thumbs up on the screen, thumbs up from our fans and our viewers. Sammy is very interested in this, she says.
Oh gosh. Sammy's in the run for
I know. She just might be our winner. All right.
Are we announcing our winners from last week's event today?
Yes. So everyone listen up. So yesterday we had our big beauty bash, and for all of you that attended, we have some winners of some major raffle prizes. So keep your raffle ticket handy. I'm going to announce the winners here momentarily. You can come here. We are at Southwest on the corner of Ming Avenue and Buena Vista until 7 p.m. And if you don't come in today, we'll still have your prize. We're not going to give it away. And once I said prize, we're getting in the comments, guys.
Is that what they're winning over there?
I think so. I think everyone's asking.
I'm looking at this cool stuff over here.
Everyone's asking, did I win the raffle? Well, let's see. I'm going to announce the winners here. So if you have your number handy, it's going to be 506209. Okay. The second is 506215. And if you enter here at Southwest, are you the winner? 505967.
You want me to read those off again?
Yes, Dr. Shaw's going to read our winners once more. Find those raffle tickets from yesterday's event.
This is from the beauty bash that we had at both Commerce and here at Southwest, and we had a lot of entries, and so thank you so much for attending the event. And it was such an awesome event. Our staff did an amazing job, and of course we love our clients coming out and celebrating that with us. But we have 3 winners, and so what are the winners getting? I'm totally interested here. What are they all getting?
Yes. So check this out.
So one of the things is a free 60-minute massage, probably with Michelle, our wonderful masseuse over at Commerce. And then we have another winner that's going to win the Latisse, which is the eyelash extender. And so they get a free month supply of Latisse. And the last...
And look at this goodie basket.
That's a beautiful basket. Looks like
the options are endless in there.
Endless. Okay, so here are the 3 winners. Okay, so here again are the numbers. Okay, the first one, so if you submitted at Commerce, we had 2 winners at Commerce, but you could come to either location and pick up their...
Southwest.
Okay? So you got to come to our Southwest office and visit us over here. So our 2 winners are, again, 506209 and 506215. And I'm going to let Nayeli read off the Southwest winner.
All right, for Southwest, we have 505967.
Wonderful. So we had a few viewers, Heather and Deanna, asking if they won. If that was your number, you could have possibly been a winner. We do have a question from Itzel. How soon can I see results after treatment? And she says, Bobby, you look fantastic.
Thank you. You should come in and try it. You need to. It don't hurt.
So, I mean, honestly, it's right away. I hear it all the time. Patients will walk out that door and they're seeing that their skin looks a little firmer or tighter. Mm-hmm. Now, it's a compounded benefit. For that first month, like I said, if you come in a little bit more regularly, you're going to see that compounded effect. So maybe after a week or 2, you're seeing those pores close, you're seeing that skin tighten.
Wonderful. And our friend Sammy says her phone is about to die. Oh no. I know. Well, that is a great way to wrap up our Facebook Live Fridays. Do we have any more questions coming in? Dr. Shaw, Nayeli, Bobby, any final words to our viewers?
You guys come in and get this. You really need to try it. It works great. Feels great.
Thanks, Bobby. Yes, it's a wonderful treatment. Thanks so much to our Facebook community out there. Join us again. We're doing this weekly. We got a cool event planned for the next time we're on air. So stay tuned. We love having you guys. Thank you so much.
Bye, bye everyone.